My name is Jill Kagan, and I'm with the Arch National Respite Network and Resource Center. I think I know most, if not all of you, who I see on our participant list. This is the next in a series of ongoing conversations and presentations we've had around respite in the time of COVID-19, and I'm especially excited about today's webinar because we're going to be sharing in a little bit of detail the recent Voluntary National Respite Guidelines we released last week around providing and receiving respite during the pandemic. And then I'm especially excited that we also have real-life case studies from several members of our network who are going to talk about their experiences and the planning that they had to do to continue to provide respite or to think about restarting respite. So I think it's going to be a very useful presentation for all of us. I have, muted all of you. You do have the capacity to unmute yourselves by clicking on the little audio or microphone that you see in the black menu that's either at the bottom or the top of your screen, wherever you decided to put it. You can always enter questions into the chat box, the chat forum that you should see in that black menu box as well. We will be stopping partway through the presentation for questions, and then we hope to have lots of time at the end for questions as well. And you can either unmute yourselves and ask the question or type it into the box, and we'll be following that. Okay. I just wanted to share with you again the resources that Arch is keeping up on our website. There's a page of resources for all of you in the network, for providers, government resources, resources from our national partners. There's also a page dedicated specifically to resources for family caregivers and for parents. And then we try to, in conjunction with our monthly Arch Quick News Update, do a supplement that's just around COVID-19 resources related to respite. And our last one was at the beginning of July. So these are all the links. In a few minutes, I'll also be posting the PowerPoint slides that you're going to be seeing today, as well as direct links to all of the individual case studies that we wrote up that'll be presented today as well. I did want to alert you to our continuing discussion around respite and the pandemic, that we are inviting Jane St. John back to be with us from charting the LifeCourse Nexus at the University of Missouri. You said she's going to be talking about how we can use the LifeCourse tools for respite during the pandemic. So I think that's going to be a wonderful presentation with lots of good discussion as well. So I hope you'll be able to join us. Again, the link to register for that webinar is up on the screen, and you will have access to all of these slides as well. I'm really excited today to introduce our speakers. First of all, Kim Whitmore, who's just been a wonderful, exciting, vibrant, and compassionate member of our network, who is at the University of Wisconsin-Madison in the School of Nursing. And she was kind enough to step forward and draft these wonderful guidelines that you're going to learn more about today. And she's going to be accompanied by 3 of our, again, network members who are going to present their case studies. Veronica Diaforley. I apologize. Jennifer, who's with the New Jersey Family Resource Network. Jennifer Sanchez from the YMCA of San Diego, California, and Lisa Schneider with the Respite Care Association of Wisconsin. And I would be remiss if I didn't also thank our wonderful work group that provided guidance to Kim and to myself as we move forward with the development of the guidelines, because they were all really having direct world experience with implementing and providing respite during the pandemic, or thinking about it, and had lots of issues that they wanted us to address and lots of resources that they shared with us. So Megan Kluth from Colorado, Jeannie Delaplane from the Washington State Lifespan Respite Program, Sherry Kaiser with Agape in Indiana, Tricia Lazar with Inclusa in Wisconsin, Jennifer again, and Lisa, both who are going to be presenting case studies today, who served on the work group as well. So thank you all very much. I also wanted to mention Sherry Kaiser, who did a presentation for us, I think it was back in May, on reopening Agape in Indiana. She did a wonderful presentation. She was at the forefront of respite programs that were seriously planning for reopening and has done so successfully in Indiana. She's not presenting today because she did a wonderful presentation for us a number of weeks ago, but she will be on the call to answer questions today as well. In case you're wondering about the links to access the report and the guidelines, they're all right here. And again, I'll be posting these links in the chat box, so you'll have access to them if you want to look at them while people are presenting. But their slides are very comprehensive as well. I wanted to just get a sense of who, and I know most of you who are on the call right now, but in case there are folks that we don't know, we wanted to get a little bit of a sense of where you are around considering considering if you're going to be providing respite services, if you're already providing respite services, or if you're a family caregiver, and what your concerns might be around accessing respite right now. So we have a few polling questions just to get a sense of who our audience is today. And the polling questions should be up there on the screen. Can you see them right now? Some of you want to wave and let me know that they're there. Yes, okay, great. The first question is, if you're a respite provider or grantee agency, are you currently providing respite services? And I'm hoping you are able to respond to those. I'll give you about 20 seconds to respond to that. The next question is, if you are not currently providing respite services, are you planning to restart respite services soon? We can see all of you starting to respond to those. That's great. Oops. The third question, if you're a family caregiver, are you using respite services currently? And the last question, if you are a family caregiver and you responded no to using respite services currently, please tell us why. And on this question, you should be able to check all that apply. I'll give you another few seconds to respond, and then we can look at the results. Some of you had some trouble responding, but I think we'll at least get a sense of where we are. On the first question, if you're a respite provider or grantee agency, are you currently providing respite? And 64% of you said yes. I wasn't expecting it to quite be that high. If you're not currently providing respite, are you planning to restart services soon? And half of you have said yes. In the near future, 7% yes, but not soon. And more than a third of you are unsure, which is not at all surprising. Maybe you'll get some more information to help you think about that a little bit more. If you're a family caregiver, some of you, 20% of you are using respite, close to 80% are not. 29% are still fearful because of the pandemic. You're not getting it because there are no available providers, or you don't have the resources to pay for respite, or other. For those of you who clicked other, as we proceed with the webinar, please feel free to enter a little bit more about what that other might be in the chat box, because that would be very useful for us to know. Great, I think that was very helpful. Thank you all very much. And with that, I would like to turn it over to our first speaker, Kim Whitmore.
Great, thank you so much, Jill. Is everyone able to hear me okay?
Yes, I can hear you perfectly.
Wonderful. So it has really been a pleasure and a privilege to be able to help support these guidelines. This is the cover of the guidelines, and if you haven't already, I would encourage you to go to the ARCH website and download these, and you can reference them as we're talking, so that if you have questions, I'm going to highlight some aspects of it, but it'd be a great time for you to kind of peruse through and pull up sections as we're going through the talk as well. So please feel free to grab those and pull them down as we talk. If you want to hit the next slide there. As Jill mentioned, I am an assistant professor in the School of Nursing at UW-Madison, and I also am the chief change officer and founder of a consulting agency, Ujima United, that does a lot of work with public health agencies and nonprofits. And what I think was really unique about the opportunity to work on these guidelines is it really combines a lot of my experience and interest areas. So as a registered nurse, of course, the healthcare aspects of COVID are of interest and concern for me. But I also have a pretty extensive history working in governmental public health. I was a local health officer and also worked for the Wisconsin Department of Health Services as the policy section chief and state health plan officer. And so I've been involved in emergency preparedness and management and have extensive experience and training in a lot of the aspects that are involved in the COVID response, and have a lot of good friends who are on the front lines in the public health response. And I also currently sit on the Board of Health for our county health department here in Dane County in Wisconsin. And then finally, as a researcher, my program of research at UW is really focused on respite care, and that's where I've had the great opportunity to work with Jill and a lot of the partners in this network with my research looking at respite care access and disparities in respite care services as well. So it was really just a perfect combination of experience to be able to pull in together and help create these guidelines. I want to also acknowledge Norma McReynolds, who did a fantastic job working on the design and layout to make the incredible content of these guidelines look so visually appealing. So I can't take credit for that. She did just an excellent job making these guidelines, and all the associated materials look fantastic. So big shout out to Norma. Next slide, please. And then Jill did already acknowledge the work group members, but I just want to also give my own personal thanks to these amazing women who met with me and provided great feedback as we were drafting these guidelines to help make sure that what we were putting forward was reliable, was helpful, and practical given the context in which you all work. And so again, thank you to all of you who helped serve on this work group. It's been great to have the opportunity to work with each of you. Next slide. So the purpose of the guidelines. So really, we wanted to thoughtfully develop some guidelines that would help trigger careful and thoughtful planning about how to provide and receive respite care as safely as possible during this pandemic. We know that any interaction is not completely free of risk, and so that's why I emphasize that as safely as possible. And we hope that these guidelines gave you some good information to make those decisions, and also help think about things to help increase the safety of respite services if that is what you choose to move forward with. We know that COVID is evolving rapidly, and we're learning more about this disease every day, sometimes every hour. And so we are committed to continuing to monitor those changes, and if there are updates from these guidelines that we need to make, we'll be posting those on the ARCH website. And then we want to give the disclaimer, but really the advice to make sure that you are staying connected to information from the World Health Organization, the Centers for Disease Control, CDC, and your local health departments, because those are what's going to come out more urgently and provide your local guidance. And it's really important to pay attention to your local guidance, and also as an individual, make sure that you're consulting with your healthcare professional to make sure that whatever choice and level of involvement you have in providing or receiving respite care is safe for your own unique health situation. Next slide. So I want to just walk through the contents of the guidelines. I'm not going to go into depth about what the contents say. That's what you get to do when you help explore them, but I just want to kind of present an overview of what is all included in these guidelines. So there's obviously at the beginning an acknowledgement section, and then a short introduction section that helps to frame what is respite care, the impact that this pandemic has had on respite care, as well as the purpose of the guidelines and the target audiences that we intend for these guidelines. We really wanted to focus these primarily for the lifespan respite grantees and agencies that provide respite services, as well as respite providers and respite recipients. However, we know that these guidelines may be useful in a lot of other settings as well, and are pretty transferable because of how comprehensive they are. So we hope that you find good value in this across other decision-making points for different types of services and supports in the work that you do. We had a section on deciding when it's safe to provide or receive respite care that was really important for us to help provide that decision-making process guidelines. And this diagram on this slide, if you're a nurse, looks very similar to the nursing process. And that's, as a nurse, how I think about this. I think that we need to really do a good job of assessing the situation, and we give good insight into what you should all be assessing in that decision-making process. Then once you make that decision, it's important to engage in that careful and thoughtful planning before you act on that decision, whether that decision is to resume respite as usual, to resume it with modifications, or to wait and continue to assess the situation. And even after you make that decision, there is ongoing monitoring that needs to occur. And this cycle really represents the continuous assessment that needs to occur at all stages throughout the process. Again, because COVID is evolving so rapidly, it's important that we're always monitoring and reassessing to ensure that respite services continue to remain safe to be provided or be received as the pandemic continues to evolve. We also developed decision guides, and this was a really key aspect that we wanted to have a tangible resource for individuals who are family caregivers and care recipients to think about what considerations they need to keep in mind before deciding whether or not they should receive respite, as well as for respite agencies, the decision questions that they should be involved in order to decide whether or not to resume or modify respite services. So if you go to the next slide, Jill, I have just a glimpse of these, and you're not going to be able to read it from this slide, but these decision guides really walk you through with a checklist and key questions that are important at all stages of that decision-making process. These are available as a downloadable, fillable appendix on the website. And so we encourage you to use these, to take them, download them, print them out. You can add your organization name at the top and determine who should all be involved in this decision-making process, and use this as a framework as you walk through and consider all of these different aspects. So there's questions to consider the assessment of how things are happening in your local context, as well as your capacity within your organization. And then there's decision points of who should be involved in this decision. Does this decision need to be made now or later? Those are some of the highlights from the decision aspect of this guide. And then we walk you through a checklist of planning resources to make sure that as you're moving forward, that you either have these plans in place or use this as an opportunity to ensure that you have updated policies and procedures and have really considered all the things that you need to do to ensure that respite care is delivered as safely as possible. Then there is also recommendations for continuous monitoring, things that you should have in place, such as screening employees and monitoring local contacts to ensure if things are changing around you, if you need to modify your plans as well. So we hope that this decision guide is a really useful tool that can be used in conjunction with this larger guide that will provide you more of the context behind each of these questions as you move forward. And this has been something that was developed by the ARCH work group, and these questions have been pulled from real life expertise from people who have gone through this and are facing these reopening decisions. And so I think that you should find this to be a really useful tool as you move forward. Next slide, please, Jill. Then we thought it was equally as important that families had a decision guide as well, because we know that this is a shared responsibility between the families and the providers. And so this tool was modified based off a decision guide that was developed out of the University of Wisconsin Division of Extension. And they have created a decision guide for families that allows families to walk through a broader group of decisions, such as should we let our children visit their grandparents? Should we send our children back to school? Things like that. And we tailored this really focused on respite services. And so this similarly is a really user-friendly worksheet to have families sit down as a family and walk through these key questions to help them understand the risks and benefits and ultimately make decisions as far as how to minimize the risk and consider different alternatives for how they could continue to receive respite care moving forward. So again, this is a great tool to use for families and to share with families as well. And I would encourage you, if you're an agency, to disseminate this specifically to your families as you're reaching out to them to determine if they're ready to have services as well. Next slide. The next section in the guide is information about COVID-19. So I know that information about COVID-19 is all around us, and there is an abundance of overwhelming information that we get thrown at us all day, every day. And so what we really tried to do is pull the key concepts about COVID and put them in a very usable, friendly format with bullet points and checklists and graphics that you can download and print and share. And we spent a lot of time trying to carefully consider what information is important for people to know that is all rooted in factual information, most of which in this section comes from the CDC and the guidance that they have about this disease as we know about it today. And so there's information about what is COVID, how does it spread, what are the symptoms, who's at risk, and how to prevent illness generally. And this picture here on the right is just one example of one of the infographics that is embedded throughout the document from the CDC that you can download from the CDC website and print and use in your own organizations as well, or even within your homes to help remind people visually of ways they can help stop the spread of the COVID virus. Next slide, please. The next section has important considerations that align with those decision guides in particular to ensure that you have thought through different key aspects of what you need to do to ensure that services are provided safely. And so there's a section about emergency preparedness plans with links to toolkits that people can use to help develop emergency preparedness plans, both in their own homes as families, as well as for organizations. There's information about monitoring and screening for COVID, including example policies and procedures that people can download and utilize and adapt for their own organization. There's a lot of information about social distancing, the use of PPE, specifically face coverings and gloves, information about hand washing, cleaning and disinfecting guidance, food safety, and then we thought it was really important to have information about caring for people with dementia or developmental and behavioral disorders. We know that in respite care, we are highly likely to work with individuals that have difficulty adhering to some of the safety recommendations, such as wearing face coverings or washing their hands. And so we have some important considerations for how you can adapt and work with these individuals and best support them to follow and comply with the recommendations as much as possible, and what to do when you can't. We also thought it was really important to include legal and ethical considerations. This is something that as an organization, we highly recommend that you consult your own legal authority, whether that's your insurance carrier or if you have a legal team that you work with, to make sure that your organization is not doing anything that is outside of legal jurisdiction, that you're in compliance with the ADA, and that you're also in compliance with OSHA guidelines as well. And then we know that all of this information is great, but if nobody knows about it or how to comply, it's going to be worthless. So training respite providers is really key. And so we provided some great information and resources on how to train respite providers to help increase the adherence to the recommendations. I know in my own life, I am shocked at how many people wear face masks over their chin or use gloves and do something with the gloves and then touch their face. And so there's simple things that we can do to help train and verify competence in individuals related to some of these guidelines to help ensure that those recommendations are going to translate into safer practices. Next slide, please. Then we also have a couple sections towards the end of the guidelines. One that is focused on supporting positive mental health. We heard over and over again, both from the work group that was involved in this, as well as from a recent survey that I was involved in through the Break Exchange, that mental health is a huge aspect that we need to be supporting during these times. Between just the fear and uncertainty of this pandemic, and then all the way through just the months of quarantine that many families have had to endure, our mental health is at high risk across all populations. And so we wanted to share information about things to look for in yourself and others related to suicide ideation, as well as abuse and neglect that can occur in the vulnerable populations that we're often caring for in the respite world. And we also provided some really tangible resources and tips, as well as hotlines to call if you do have a crisis or suspect someone is in danger. Then we have a section on redefining respite care. What we found through the Break Exchange survey is that many organizations, and Arch has found this too in their calls, that many organizations are using this opportunity to really rethink how respite care is delivered, to shift services, to address other needs that are more prominent right now, such as food and housing in the midst of the financial crisis that this pandemic has also had on many families. And so we have a section that highlights some of the ideas of what organizations have done to redefine respite care and adapt their services. This picture on this slide shows an elderly couple using video conferencing, and a lot of respite agencies have done that. They've switched to sort of virtual respite services, or at least increased contact with families to do check-ins with them. And I think that's a really great opportunity for people to capitalize on during this time. Then we have a section about the shared responsibility of these decisions. And we provide at the end sort of a very quick summary checklist of what we feel are the key responsibilities of each party. So there's information for respite agencies, respite providers, as well as families and care recipients to ensure that you are able to consider your own personal responsibility in this. And we also have a link, and we'll share that in a slide in just a few minutes, that has an example oath of responsibility, because we feel it is really important that everyone understands their shared responsibility and commits to that before the relationship to continue respite services resumes. Then our guidelines has a quick summary, extensive list of resources that was developed to help, or used to help develop these guidelines, and we were able to include hyperlinks to all the references and resources throughout the document. So if you access it electronically, it's a quick way to grab additional information by following those web links, and encourage you to take a look at some of the additional resources that are available. In that resources section, there's a lot of great information that is downloadable templates that we share that were also not specifically called out in the guidelines. So I would encourage you all to just take a careful look at those resources and identify what's most helpful for you and utilize those resources. Next slide, please, Jill. And then finally, at the end of the document, we have several appendices. As mentioned earlier, the oath of personal responsibility is one of those, but we also have the respite agency decision guide, the family decision guide that I talked about earlier, as well as example template health screening policy and procedures, competency validation checklists, and all of these are posted on the Arch website and available as downloadable and fillable PDFs. So again, great resources for you to access and utilize and adapt for your programs. Next slide, please. So in summary, as mentioned before, just really want to remind you that these are all available on the ARCH website. Those hyperlinked references are really great ways to get additional information. And as I mentioned at the beginning, as new information and resources do become available, we'll continue to update this guide. If you have additional ideas, resources, or examples of success stories that you want to share related to reopening during the pandemic, please send those to Jill so that we can continue to share these resources broadly to help increase the safety of respite and ensure that we can continue to provide respite services now during a time when it is needed more than ever. Next slide, please. So finally, I just want to thank you again. Thank you to Arch and Jill for allowing me the opportunity to work on these guidelines. Thanks to the great workbook or work group who helped to support this. And thank you to all of you who are out there on the front lines providing respite services, whether you are individual providers or agencies that are working to continue to support families. It is so important. This is, again, an unprecedented time where we see the needs for respite increasing more than ever at a time when they're often not as available as usual. And what I like about this picture here is it actually reminds me of one of the common analogies used for respite, being that you need to put on your mask first, your oxygen mask first in the airplane before assisting others. And I think now we can adapt that metaphor to put on your face mask before assisting others. So really important in the time of COVID that each of us remembers that we need our own respite and self-care to continue this work, because it is challenging, it's difficult, and we're all living in this pandemic with a lot of uncertainty and stress. So my wish for each of you is that you're able to find your own sense of respite and continue to care for yourself as you do the great work and important work of helping to support others. So at this time, I think we're going to pause for some questions, Jill. Questions and comments?
Yes. I think we'll take a few minutes for questions for Kim. You can either type your questions into the chat box or unmute yourself, if possible, and ask Kim directly. Any questions? Great tools, much appreciated. That's in the chat box. No other questions? Okay, again, if you think of questions as we proceed and they're specifically for Kim, just let us know that and type it into the chat box, or we will, once we make all of our presentations are completed, then we'll open it up to everyone and we'll have questions and comments. There was one comment here from Chris Blackwell that I'd like to go ahead and read to you. I think she was responding about being able to do respite provider training now, and she says she's at a standstill in Illinois as a volunteer respite companion trainer. Most of the people she's trained are over 60 and thus reluctant to go out into the public at this time. Also, most of the venues where she trains are closed or limited to a small group, and she herself is over 60, so she's waiting a while to go back out and train. Thank you for sharing that insight, Chris.
Yeah, and I would just add, Chris, I think that's a great example of how everyone does need to look at their own health and risk, and being older is definitely a risk factor. And so anything you can do from that training regard to do that virtually. I know not all training is conducive to virtual learning, but if there's a possibility to do some of that virtually, that might be a way to reach people. And then the opportunity here is to try to recruit younger volunteers, right? So knowing that we have more volunteers in that older range that are at greater risk, that might be an opportunity to do an appeal to try to get more younger individuals into that volunteer mix to help reduce some of the risk on those providers as well.
Yes, that was an excellent recommendation, Kim. And just so people know, Arch is also updating our volunteer respite manual right now, and we're probably going to release that next week. Now, I know for a lot of you, actually recruiting volunteers now or running volunteer programs can be very difficult, but again, in the context of providing respite safely, there may be opportunities, and we address those concerns in the volunteer manual as well. So keep your eye out for that. There is one comment from Cheryl Donnell. She says she can't wait to review all the documents, but she'd like to know how much person-centered planning concepts were included.
Yeah, so I think that one of the things that we are focused on in this document is ensuring that this is a shared responsibility and that we work not just with the providers of the respite agencies, but that we are connecting with the families as well as the care recipients, the individuals with disabilities, to ensure that they are involved in this planning process as well. So I think that was important. One thing that we did not do specifically in the work group is have individuals with disabilities or family caregivers specifically in that work group, which I think would have strengthened it. But I know many of the work group members also are dually family caregivers and have that experience, myself included. And so I feel like a lot of what we did was really with the eyes of individuals with disabilities in mind moving forward. And then we are talking about trying to pull out aspects of this that would be more specifically targeted for families and individuals with disabilities. And so we're hoping to have sort of a shorter version of this that would be a little more accessible and user-friendly for families that we do plan to have reviewed by individuals with disabilities and their families, so that we can ensure that it's really geared to be more practical. I think we tried to balance that in this document, but I think it's a little bit skewed on the agency side. But there's a lot of good information that I think is person-centered in this document as well.
Okay, one more question before we move on to the case studies from Leanne in Massachusetts. She has two questions. Are the tools available in other languages? Good question. And also, are there any informational videos able to enhance existing trainings?
Yeah, great question. So we are working to translate the entire guidelines into Spanish. And so that's going to take a couple more weeks because that's a big undertaking to translate this all into Spanish, but that is in the works. Many of the resources that are referenced from the CDC and the handouts and downloadable documents that they have are already available from the CDC in multiple languages. And I tried to mention that and remind people of that throughout the document, that a lot of the diagrams and figures and infographics that are included from the CDC, you can go to their website and they're all listed by topic in that resources that you can just click and get a direct link to those resources. And those are all available in multiple languages. So I would encourage you to take advantage of those if you need those in the populations that you work with. And then informational videos, again, throughout the document, there are a few references to online videos that are helpful, some training videos, as well as like hand washing demonstrations. There are some of those referenced throughout the document. And again, in the resources section, there's some additional links to helpful videos. So I would really encourage you to take a look at those resources. And they're all hyperlinked directly to where you should be able to find those things, at least where they were when we developed these guidelines. Sometimes they change things around, but we'll try to keep an eye on those if any of those links get broken. But there are some good videos that we were able to find throughout this process, and we shared those when appropriate.
And we really did cast our net widely around the videos. There's even a video on how to clean your wheelchair or keep wheelchairs clean. There are several videos from Teepa Snow about how to get someone with dementia to wear a mask or cope with social isolation. So there really are some wonderful links to videos in the document.
And I see Connie's question about the coronavirus handout. So the other thing that throughout the document, any of the CDC infographics, if you actually click on the image, it's hyperlinked directly to the downloadable version of that as well. So they're listed in the resources reference section as well, but if you click on any of those diagram infographics throughout, it'll take you directly to the downloadable version of that on the CDC website as well.
And then a question from Melissa, who runs a wonderful respite program with nursing students in Virginia. She said, I have a big concern about my program as the respite care workers are nursing students. These same students will be completing inpatient clinicals at the same time as participating in the respite care program. I'm very concerned about those nursing students exposing families because our recipients are children, a majority with autism spectrum disorder.
Yeah. Yeah, Melissa, that's a great, great question and concern. And, you know, we're dealing with this at the University of Wisconsin, trying to figure out what's going to happen with our nursing students. So it sounds like you're already planning to have them in clinical, and that does increase their exposure rate. I think there are recommendations in the guidelines for providers and volunteer providers being important providers in many programs on how to screen and implement those screening protocols. So I think that that's going to be important for you. And I think really making sure that the families are aware of that secondary exposure. One of the questions in the decision guide is, you know, is anyone involved at high risk, and what's the other exposure that people have? So you may think, oh, it's just one student coming in, but if that's a student that's on a respiratory floor in a hospital working with active COVID patients, that's a greater risk. And so families in your program may not feel that that is a risk worth taking, especially when you have children with an autism spectrum disorder, many of whom are not very comfortable with wearing face coverings. That poses an additional challenge. So those are all complicated questions that I think you have to really carefully weigh the risks and benefits of that, and that the families need to be really involved in those decisions as well. I think the challenge is there's no like concrete yes answer that this is going to work out great and be no risk by doing these things. There's always going to be some inherent risk. And so you just have to consider all the different parties involved in that decision process and make sure that everyone's okay with whatever decision is made in the end, and that you're following as many of the safety precautions as possible. You also, in your situation, will want to talk with your university legal team. That's going to be an important thing for them because, you know, I can see the headlines now, you know, that university students bring COVID to, you know, kids with special needs. And so you want to make sure that the university is okay with that liability as well, and they may not be. And so there might be other things like virtual respite services or other ways you could adapt your respite program to continue to interact and support those families, knowing that this is a very difficult high-risk situation for many of those families. And I'm happy to talk with you more about that and brainstorm with you, Melissa, offline.
Wonderful, thank you. That was a great question and a great response, thank you. We'll now move on to our case studies because I want to make sure that we hear from everyone. Let me turn it over to Veronica, who's with the Family Resource Network of New Jersey. Please go ahead,
Good afternoon,
Veronica.
everybody. So I'm Veronica. I'm with the Family Resource Network. I've been here for almost 25 years now. But I was really flattered to be asked to be part of the case study, but more importantly, it was almost therapeutic for me to go through this process because I didn't really realize how much we had to do in such a short amount of time to keep up with the needs and continue to keep up with the needs of our families. I'm going to start off by telling you a little bit about our organization. We happen to be celebrating our 50th year. 2020, go with 2020. It seems like a crazy year to be celebrating a 50th anniversary. However, we did start off as the Epilepsy Foundation 50 years ago. Respite was one of our founding services in which we are committed to this day, along with a lot of other services. We are now part of a network of organizations. Under the Family Resource Network, we have our Autism Family Services. We've kept our founding organization, Epilepsy Services of New Jersey, as well as Caregivers of New Jersey. We kind of evolved based on the needs of our families over time and worked with people additionally to having epilepsy, but other developmental disabilities. On average, we're serving about 1,800 children and adults with disabilities monthly. The funding that we receive are all part of the Department of Human Services, and then each are coordinated depending on whether they're a child or an adult under the Department of Children and Families or the Division of Developmental Disabilities. Some of the services that we provide generally, it's separate from our respite services. We have in-home and out-of-home community-based options such as after-school camp, day camp, summer camp, and some other community inclusion type activities. When when COVID affected us, really the most was March 12th, where we had to stop anything we were doing in the community and anything that was a group. So at that point we shut down. Then we really had to defer to our funders to find out at this point what we could do and then plan accordingly. So it was more of a phased in process for us, depending on the population we were working with, children or adults. And we were able to do that slowly, even though there was a significant reduction. And that all happened over, let's say, the first 30 days of us having to slow down or stop our services. As we move into the planning and the next steps of things, really this became the time where we were trying to gather all resources possible. And I can add Arch to that list because those tools are going to be tremendous for us to share with our families, as well as our coordinators that are running the services today. But at that point, we were really just trying to figure out where information, we were a sponge, what was going to be the best way to keep our families and our staff safe. Some of the places that we reached out to obviously were our funding sources, but in addition to that was the CDC. We also happen to have on our team a health and innovations team that's comprised of lots of public health experts. And so they were doing their due diligence. And of course, we were following our governor's orders as they were unraveling. It really was for us to then figure out, all right, what of each of our funders, what were they going to continue to let us do or not do? And of course, you know, there's some challenges to that, which I'll talk about. We immediately applied for the PPP as soon as that was available as well to try to keep our staff intact while we were still trying to figure out where we were going. And then it became a full court press for us to obtain PPE just like everybody else in the country. And we've worked with a lot of New Jersey organizations who are trying to obtain that, get it for free, get it for our families, get it for staff. And we made, because we are a statewide organization, we really had our staff throughout New Jersey, I mean, literally going to mom and pop shops everywhere to collect whatever they could get their hands on at that time. Things have gotten a lot better since then, though I think we might take another dip in the demand to being able to access it in the near future, given our circumstances. And then along with doing all of this, we also started outreaching, obviously, to all our families and all our staff. And I mean, we did email, we did social media posts, we did individual calls. And when we didn't reach people, we started all over again. So we had kind of had all hands on deck. We didn't want anybody to be left without the information they may have needed or the resources. We did identify for us regional respite coordinators in each part of the state. And each one of them were responsible for reaching out to the families within their county. So it helped us to at least divide and conquer in a semi-productive way. And then we also disseminated, we needed to figure out for the staff that were going to continue to work, how do we get them that PPE? So we drop shipped to certain coordinators throughout the state a supply of everything that we could get. Then we either did a whole protocol of people coming to pick it up, with all the social distancing and all the protocols in place. We would sort of bag and tag it, put it on a porch, and a staff person would come pick it up. And in cases where we could ship, we did that too. But with us being statewide, it wasn't exactly reasonable to be shipping PPE to DSPs throughout our state. And we have somewhere of upwards of 150 DSPs. We then had to figure out, we need to develop a protocol with all the information that we have so that we could not only disseminate it, but make sure that everything was used properly, disposed of properly. And so then we put together our own internal protocols for that. And that's a evolving thing as new information comes out, but we needed to take a first stab at it. And we needed to make sure that everybody was feeling safe so that we could resume services. Another thing that we had to do, mostly because of circumstances, that we began to track for us, exposure, testing. Unfortunately, those who may have passed that we directly supported. And we were sharing that information with our funders, who was also collecting information from other providers here in the state for a more grander perspective on data. As we go into the next slide, Jill, for training and resources. So in order to actually make this all happen, we started to call our DSPs and provide individual orientations on what these protocols were going to look like and how they would actually implement them. We would have trainings by Zoom, we were doing trainings by phone calls, but we also then said, how can we keep our families connected to us, even if they're not going to resume with respite, but we just didn't want them to feel completely disconnected. And I think a lot of people did the free offerings. So we did what we call our FRN Connect, which was a virtual Zoom with all real, listen, there was informational stuff in there, certainly, but we also tried to shake it up and keep it, you know, fun and family friendly, things that our families could do together, whether that was like Zumba or yoga classes. We incorporated story time that may have had a relevance to social distancing and keeping in touch with your friends, something that had a theme and was relevant to the current situation. We got a great response from that. We had a lot of families that tuned in, which was, you know, assuring to us, and it also gave us another means to continue to keep that connection going. One of the things we offered to our staff, the direct support staff, as well as our full-time staff and coordinators, was on Fridays, we had a social worker who would dedicate time to giving our staff an opportunity to call in. You know, some of those things were just talking about life and what's going on and what's going on with them as a person. And then certainly there was things about the stresses of, you know, I need help as a DSP. These are the things that I'm concerned about. But we really just wanted to give everybody an opportunity to be listened to, or maybe just talk about something else that's going on in their life. Because I feel like it was stressful for everybody all the way around. And then, Jill, we could go to the next slide for reopening procedures. So those regional coordinators that I mentioned, you know, they were really instrumental in locally beginning the steps of getting back into the homes. And obviously this is only if the family was open to doing it, only if our staff were comfortable and open to doing it. And we were just going to make sure that they had the right tools to be able to do all of it if they wish to continue. So a lot of that was done by phone and some Zoom meetings to make those connections between, you know, the coordinators, the staff, and the DSP with the family. You know, we went a lot back here in New Jersey, we went back and forth a little bit. You know, agencies like ours had to find their own PPE. And so we joined forces with other providers like us. And then we did have families asking us for PPP too. And it was a large need. And as much as we would want to give to everyone, we needed to figure out that on a different scale. And actually our state agencies did rise to the occasion and begin to help through our case management system to provide PPE to those families in need, which we were really grateful for. And then one of the things that just sort of came along with it, as you would expect, is, you know, we might be answering families' needs about respite, but some of those priority items, as we shift to see what respite starts to become, we were getting a lot of calls about food assistance and rental and not being able to pay their mortgage payment, health insurance, those kind of things. And so we do happen to have an information and referral staff here. And so we did our very best to disseminate and collaborate with other providers to get all our families what they needed during this time. And we can go on to challenges and opportunities. Thank you, Jill. So the biggest challenge from where I sat was that we were working with two state entities. And as much as we would like to think that they talked to each other, they did not, and they did very different directions. And so we were kind of like, okay, this is what the children's system said we could do. All right, go. This is what the adult system said we could do or not do. Go. And then almost, you know, daily, weekly, that was changing. And so we had to really adjust and proceed, build the plane as we fly it, so to speak, which we did. We also tried to find other ways with the challenges. How can we still connect to our family? So we came back with, you might have seen a lot of other people doing porch pictures and ways to tell stories about our families. And we posted them on our social media, you know, to celebrate the successes when things were really challenging. So I think, you know, that was an opportunity for us to, again, be more connected to our families, I think, than we ever have been. Crisis does seem to bring people together, so it certainly did that for us. I always knew our DSPs were the foundation of what we did, but man, was it so clear to me during the last few weeks and as we go forward, how imperative they are. And we constantly advocate for our DSPs here in New Jersey to get, a better rate of pay. But we are really dedicated to doing anything that we can to make this as easy as possible on our DSPs, provide opportunities to stay connected to us and resources. And I know I keep saying connected, but it's just been an eye-opening experience for us. And we will find a way in the future to show our DSPs how truly proud we are of the work they continue to do, and to help our families. Overall, the challenge for us, we had about a 15% reduction in our in-home respite during this, which I've heard is in other places have been significantly higher than that. But we've had some other pieces of us that have been able to be maintained. We do some behavioral stuff for children. We've been able to morph into telehealth with that. So there's been some other services that has been able to keep things going while other things have suffered a bit. And then one of the opportunities that came out of this is that we had applied for the New Jersey Pandemic Relief Fund to be able to provide free respite to families who may have exhausted what they did have and still need more. So we are actually in that as we speak. We were only recently awarded that, but that is something that we'll be able to help our families out, which I'm really grateful to be able to do. We can move to respite service continuation. Thank you. So I certainly anticipate that, this is going to change us for the foreseeable future. And this will be the new normal, so to speak. I think the more resources that we can continue to provide to our staff, to our families, to educate them so that they can make, good decisions about what they want for their family member is in the forefront. We continue to try to obtain PPE because we're using it on the regular. We want to obviously advocate for our DSPs. There was something that happened here in New Jersey where the DSPs that we employ were not included in a hazard risk pay temporary amount of money that was given here in New Jersey, which was a real shame for the staff who are doing the traditional family support stuff, and they're not doing it in group homes or licensed settings. So that has been a new advocacy effort for us to try to get them in the mix. If not, what can we do to move forward to help them to get the increase they should see? And we're continuing to look for the PPE. And I think that's kind of our story. The fun part about that is that was all happening simultaneously since March 12th, and we really haven't been able to catch our breath. But we are committed to respite. It was our founding service. It continues to be something we're going to make a way, meet families wherever they're at, whatever their comfort level is, and continue to support our staff through that process as well so they're safe. And then the last slide really is my contact information. If you have any questions, I'd be happy to answer them.
I think just in the interest of time, I know your questions are all very important to us and to our presenters, but we're going to proceed to hear our other two case studies and then open it up at the end for questions. If we don't get to your questions, we'll respond to them via email. And thank you so much, Veronica. It's just amazing what you're doing in my great home state of New Jersey.
Thanks, Jill.
And I especially love that free respite you're doing now. And I'm wondering if other states will learn that later, if other states have funds, pandemic funds that they've been able to access for respite. Yeah. But let's move on now to Jennifer with the YMCA in San Diego. Go ahead, Jennifer.
Hi, I will try to keep it brief as well. I'm Jennifer Sanchez. I'm one of the program directors over at our YMCA, and a lot of people are surprised that the YMCA does respite. We are very unique in San Diego. We do have a social services. That's what we tell people outside of the gyms. We're the social services part of the YMCA, and in-home respite care has been with us for over 25 years. So we work directly with San Diego Regional Center. So we're very lucky here in California, and that's what I keep hearing every time I meet a lot of you guys at our conferences. We are very, very lucky to have regional centers here in California. So we directly just work with one funder, which is San Diego Regional Center. And we provide respite or short-term relief from the constant caregiving for our families that have a child or an adult with a developmental disability. Now, we have a wide range of spectrums. So we have some toddlers ranging all the way through clients in their 60s. So there's really no age limit per se. It's mostly based on the needs of each client, which also we're very lucky to have that. So our regional centers have what they call service coordinators, or they're social workers per se, and they're the ones that actually make all the intakes, all the determinations around what's the need of respite and how many hours that is. And they all get quarterly hours based on the factors that they use to determine the need for respite for each client. Now, we currently have about 370 part-time staff, and those are YMCA staff. So they are just like me and any other YMCA staff out there that get the same benefits as we do. So we're lucky to have 370 of them. We currently service about 1,000 clients, again, ranging all in different ages. And we usually, before COVID, it was about 10,000 hours of respite every month. So we are very busy in our program here in San Diego. And we're just one of many vendors that Regional Center works with. Next slide, please, Jill. So very similar to Veronica, we also suspended respite services when our governor created the stay-at-home order in California. Our executive director decided that it is in the best interest of our families and our providers to suspend services until we came up with a comprehensive plan and really try to see if we were deemed essential, right? Or what you would call essential here in California. And I think that was the biggest challenge. Like Veronica mentioned, that was our biggest challenge, which I'll discuss a little bit later. So we did stop in-home services, and then our out-of-home services is basically licensed providers that have a family daycare. So we continue those services as they're considered more independent contractors. So we only stopped services that that involved our internal staff. And so that was our in-home respite services, which is our biggest program. If you can go to the next slide, Jen, please. So our planning and guidance was extensive as well. As Veronica mentioned, we had to work not only with our leadership team at Child Care Resource Service, which is our main branch, but we also had to talk to our corporate office or our team headquarters. And as you guys know, our gyms were closed. So there was a lot of things going on. So we had a lot of discussions at all levels. And we were researching at the same time what protocols, if we were deemed essential, what do we need to get in place to make sure that we protect not only our families, but also our staff, which are our providers. And we used information resources from the CDC, California Department of Health, San Diego Health Department, in OSHA guidelines. My supervisor is very involved with OSHA. So we had to take a lot of different approaches and looking at what was the best approach to take when we would decide to reopen. We also had to decide to buy a lot of the PPE. We signed on a letter to the state, to California, along with other service providers with San Diego Regional Center behind us as well, to request PPE for our families and our staff. So we were lucky to get some, not enough for everybody, but as a YMCA, we also were, we had contracts with agencies that deemed us as essential because of the childcare also that we do. So we were lucky enough to have access to some of the PPE faster than other agencies. So we were lucky to have all of that. So we did, it came in waves, some things were more available than others. And then we also immediately started working with our public health team at team headquarters to develop the health screening guidelines, working with HR because again, they are YMCA staff. So we had to work with various departments from the legal team to the HR team to our public health team. So we were lucky enough to have a lot of resources on our team as well. And we were able to create all the health screenings, which it's on the booklet that we have, so you can access it as well. And that took a lot of work again from multiple people. Next slide, please, Jill. We also surveyed families through this time because we didn't know if the families would feel safe letting people come into their home. And we actually had a pretty high response rate of 70%, although now that we're open, we are actually not seeing that number. So during the closure, we understood that we weren't meeting the needs of certain families that needed respite. And we understood that, and that weighed really heavy on us as an agency and us as staff. So we work with Regional Center, and those families that needed the respite right then and there, we kind of had to hand them over to Regional Center and say, these families need respite, so please connect them to another agency to make sure that they continue their services. And Regional Center was great through this whole time in meeting their needs. So we were lucky to have that. We also had our legal team create a liability waiver for our families. So that was very specific to COVID as well. So there's a whole COVID section on it that needs to be signed prior to receiving services from us. And that was a YMCA agency-wide waiver that included respite again, because we were serving respite families. For our staff, we were able to, so we had to close until the mid-June. So June 11th, we came back. So we didn't provide respite services for a few months, so from March through June. And during that time, this is what we were doing. Once we brought back the staff, we understood that maybe not everybody's gonna be comfortable coming back to work as a respite provider. So we connected them with our HR team as well at our corporate office to make sure that there was discretionary leaves as needed and extensions or accommodations as needed. And families, of course, if they didn't feel comfortable using respite, then they just wouldn't use respite. Next slide, please. So during all this time, we were also creating an online training for our respite providers. And we are lucky enough, again, to have a lot of resources. We already have a system, a software that we use for trainings, online trainings for our YMCA staff. So we just added another layer of trainings. And this one was very, it was just related to COVID and what to expect, how to health screen, how to use their PPE, in things like in working with the families. So we did that. We also did a contactless drive-through of the distribution of the PPE in bags. And you can see what we included on there. We did masks, both cloth and disposable. We did gloves, soap, safety glasses or the goggles, and hand sanitizer gel for each respite provider that we had. And these were all requirements prior to even going into a respite appointment. So they had to get their kit, their PPE, and they had to complete their COVID training that showed them how respite will look moving forward. They were also advised to use the PPE for clients if they were displaying symptoms. So we were very specific about that. And that's why we did a box of disposable in case a client needed to wear a face mask and they were able to without any medical, any issues that they might have that would impede them from wearing any face mask. We asked them to do a health screen 24 hours before, and also prior to entering the home, they're doing the health screen to make sure that the family, everybody in the household is not displaying any symptoms, as well as themselves. So they also did a health screen on themselves. Next slide, please. So obviously we had to think about if somebody answered yes. We had to make sure that there was a policy in place for the staff themselves. They would contact their direct supervisor, and then we would have to do all of our reporting as an agency as well. And we also had to report to San Diego Regional Center, which is our funder. In families as well, we would report to San Diego Regional Center, and we would need return to work notes from a medical provider from our staff to make sure that they were clear to come back to work. They were also in our office where, since we are very social service heavy, we do a lot of trauma-informed care, and we understood that through this time, this could have a lot of traumatic effects on our families, but also on our providers. So we made it mandatory that from the day that they came back to work, they had 30 days to complete this online training on trauma-informed care around COVID time. So it was very specific. Our team developed this training around trauma-informed related to COVID. And we've gotten really good feedback regarding that training. And I think it's just very useful to also think about not just the health risk, but also the mental health that Kim kind of mentioned also in her presentation. So we were very happy to be able to do that. We did ask that all of the providers physically distance as much as possible, especially from the family members. And we let the families know as well. We understood also that if there was no physical distancing available between the client and the provider, we asked that the providers wear a mask at all times. And if the client was comfortable wearing the face covering, that they also would get that disposable face mask for the client. Next slide, please. And that was it. So right now we're running. We're definitely open and running. We just opened again mid-June. So our numbers are still not where we thought they were gonna be. But again, there's a lot of things going on in California and specifically in San Diego. We just got the modifications in place again. So we're back to the beginning of phase 2. So unfortunately, we're in a place where maybe families or providers don't feel as comfortable. So we're just continuing to monitoring that. But again, we're very lucky to have funding from the state through the end of July for any COVID-related absences. So that honestly has helped a lot of the agencies stay open through this time. But if you have any questions, my contact information is in the front of the presentation. And I know Jill will send this information out as well. So I'm happy to answer any questions if anybody has any questions at the end of the presentation.
Yeah. Thank you, Jennifer. That was really excellent. I know that California has more resources for respite than many states, but wouldn't it be wonderful if we had respite in the YMCAs across the country? I'm going to thank you again, Jennifer. That was really excellent, very detailed and very helpful. I'm now going to turn it over to Lisa with the Respite Care Association of Wisconsin. And she's going to go ahead and share her own screen and do her presentation. Lisa, are you able to share your screen?
First, I needed to unmute so I could see. I covered my screen. So are you guys able to see my screen now?
Yes.
All right. So, well, thanks for the opportunity for us being able to showcase what we did during the COVID pandemic and as it continues. I did want to say right off the bat that we are very different in regards to the prior two presentations in that we are not, we're kind of like a standalone organization that is really, we're not a provider, we're not an employer, we are strictly a connector, we are a gap filler, and so we're just very different. And so we really work to support family caregivers, self-directed consumers, and we help train and recruit persons that want to be respite care providers, and we work to connect people on both ends of the spectrum. So with when the onset of COVID hit, we became super busy, as it sounds like most of you all did as well. And I just have to say, even though I'm the one presenting this team of people here, I could not be any more thrilled to be able to work with such professionals and hard workers, and creative people, so that we did accomplish all kinds of things that we're going to be able to showcase to you. You can already read the narrative of our case study. So what I wanted to do was really showcase the tools that we created. So it's going to be a little bit of talk and a lot of imagery. So, so my PowerPoint, if ever you do download it, it's going to be a little different than the others. Always me. So what we did at least is in the very beginning, we sent out emails to caregivers who had used the Caregiver Respite Grant program that we have, and also to find out for persons who are listed on our registry, we wanted to get a gauge for what the comfort level was right at that time. And were people willing and comfortable going into homes to provide in-home respite? Were care receivers open to having their home open to somebody coming on in to receive respite, and what those barriers were, and would PPE resolve that barrier? We really found that PPE would not have resolved that barrier at the very beginning. I'm sure probably a lot of you felt the same way. But what we did with that then is we just we realized that people were going to hold off on things. So some people held off on they had scheduled some caregiver respite grant time off. A lot of people put those on hold. And then a lot of providers, what we'll talk about in a little bit, but the initial part of it was just the outreach. And so part of that outreach consisted of staff deciding to do 5 days of webinars the first week of our shutdown, which was on, all the bars had to close on St. Patrick's Day. What a day to start closure. People were all geared up, and our closure started on March 18th. So we held webinars for the first 5 days of that week, and here's the flyer that went out to everybody. We blasted it out, and it was really well received. We had people, we had really high attendance rates at each of these daily COVID-related webinars. We also had periodic webinars that were more specific in regards to what resources are available, how can Respite Care Association help with what's going on during COVID, preparing for telehealth visits. So that's just an example of one of the webinars that was more concentrated and specific, in addition to just the daily what's going on out there webinars. So then we also did a lot of internal planning, and through a lot of discussion, a lot of research, and collaborating with statewide agencies, we were starting to form a plan that we wanted to be proactive and not reactive in supporting people who are part of our program. So we were able to repurpose some of our funding that we had scheduled for conferences that we were going to go to. The biggie, we didn't have this, but this year we had a lot of money to save from that. And we also had some big conferences that got canceled, and so we had some money to repurpose. We decided as time went on, and as people started to get a little anxious about maybe needing a little bit of a break, and that we were open to doing some activities, especially outdoor activities. We decided to offer a meaningful activities program where we would pay for materials for people to do activities. And I can tell you the biggest thing was us providing them with a state park sticker. So it's a sticker that was either available to the respite care provider those that were listed on our registry or the care recipients that received money from our Caregiver Respite Grant Program. And so one of the conditions was is that if they took any of these activities, that they had to send us a picture and allow us consent to use that as part of a promo. Overwhelmingly, the park sticker was a big thing, and it's an annual park sticker. So hopefully a relationship starts there and they can continue to do those activities. We also reached out to everybody on our registry that were trained workers to see if they still wanted to remain on the registry as active, or did they want us to temporarily suspend them from the search. So if people were looking for them, they weren't contacting people who didn't really want to be providing services. And so we did that, and we adjusted our registry accordingly. And then we began purchasing personal protective equipment and supplies. And we went so far as to I have a friend who does this kind of stuff. And so we got some RCAW personalized face masks that will be part of our PPE package that we send out to those that are workers on our registry and those that are recipients of our Caregiver Respite Grant Program. We also expedited our Caregiver Respite Grant Program. A lot of the times we're having to wait for confirmation of information from counties or ADRCs. But we had a number of requests that were more, as much as some people put things on hold, we had a number of people approach us due to emergency situations, such as parents that were essential workers and didn't want to affect their families. They had no time to come up with a game plan. We were able to kind of serve and be flexible and creative in assisting that family. Similarly to another person wanting to get her mom out of a nursing home because she was concerned about the care she was receiving. And so we helped that person with some funding until a longer game plan was able to be implemented. We also participated in these geographic service regions throughout the state of Wisconsin. So there's almost 20, I say 14 there because a lot of them combined to make more regional geographic service regions. But each of these regions, these colored regions, met minimally once a week. Some of them met 3 times a week. We were on every single call so we could know what was going on. So we became Zoom experts. But it really helped knowing what was going on, especially up here in the northwest part of Wisconsin, which really has a lot of trouble, as does the southwest part of Wisconsin. So it was really helpful to hear what was going on in other areas so that we could maybe adapt some of our programs to meet some of the needs that were being faced. We also developed a dedicated COVID resource page, and again, staff just blows my mind sometimes. So this thing basically popped out of nowhere because these guys just took it upon themselves and created these wonderful consolidated page just for COVID-related resources, and a lot of them are our own very tools, along with access to, state and federal resources as well. We also created a tool for caregivers, much like the decision-making tool that you see in the document that Kim worked on. One of our staff, I don't know if you can see that or not, created a document that will help people go through, so what is your plan if I become infected? So for somebody doing this for themselves, or what if I become infected? What's my game plan? And so this was one of the tools that's created, that's available on our website. Also, we created, staff created a new comprehensive training. Again, it's free to anybody from anywhere. And it's all about people, whether it's consumers, providers, family caregivers, anybody who's interested can just register and take this training for free. And there's a lot of great information in there. And then part of those GSR meetings that I had mentioned up earlier, one of the geographic service regions decided to create a document called Help and Be Help. This is the second page of it because it's the part where we're kind of mentioned in it, and I just clipped it off. But So that was nice that we came together with one GSR, but we made a statewide product just by working together. So that was, we were really proud of that. We were also asked to partake in a number of media opportunities, whether it was press or being on TV. And here we have our Rachel featured, just talking about resources that we have on one of our local channels. We utilize all kinds of social media platforms to let people know of the resources and programs that we had to support them during this COVID pandemic and beyond. We reconfigured previously planned activities that were going to occur as part of our mini grant program that were going to be in-person events. And some really cool creative ideas came out of it. This was just one of the free webinars that was built into 3 different segments with this group that could no longer hold these sessions in person. And so there's a whole lot more of these particular flyers that I could share, but this is just one example. And then we also wanted to reach out to a lot of the folks who lost jobs during COVID, that if an adult day center closed down, which I was personally affected by with my daughter, and a lot of staff were laid off. And so part of those GSR groups, again, when we got together, we talked about, boy, some of them do want to work because they want to work. And so we give them an opportunity to be listed on our registry as being available to work under the condition that it was a temporary situation, and that both agencies, the one that had let them go or furloughed them, and the one that was temporarily going to hire them, there was an agreement that was developed that they would sign, so that we were not taking employees from employers, and it was meant to just be a temporary solution. So we only had a couple takers on that, but it was still, I thought, an interesting approach to take. And then we also sent out, put together these care baskets to just send out to all of those that were recipients of our caregiver respite grant program. So it included just some little activities or things to self-care. And I know Margie talks about the number of emails that we received back about just getting that package that day made all the difference for them. So here at the last page are just some of the things that we're continuing to do. So we're going to be continuing to update our COVID webpage. I just learned today again that we've already further expanded our portfolio of training programs that are online and that are all free. We continue to monitor our registry to see kind of how much it's being used and how much it's being searched. We continue to look for new ways to provide supports to families and providers through various means of outreach. And we obviously share state pandemic updates as we get them. And we continue to stay actively involved in what's going on with the state, because some of these geographic service regions are continuing to meet. And I just wanted to throw out there that for anything that we have, or even our online stuff with the trainings, we are always open to collaboration. There's no possessiveness of what it is that we offer. We're doing something with South Carolina, but we're always open to collaboration. So just you can contact any one of us, and we'll be happy to find a way to work together. That's it.
Thank you so much, Lisa, and we really appreciate your generosity with sharing all of those wonderful resources too. That's just fantastic, and I'm sure everybody's very grateful. We have run out of time, but we do have a couple of questions, and if our presenters are willing to hang out for another 5 minutes and maybe respond to those, and those of you who are interested in staying on with us and hearing maybe a little bit more discussion, I think we'll proceed for another 5 minutes or so, if that's okay with everybody. Okay, great. There was one question specifically for Veronica, which now I've lost.
I think
you mentioned, Veronica, that your experience with COVID exposure as you were implementing the protocols and monitoring that, and you said you were tracking and collecting data on that.
Mm-hmm.
I guess you'd like you to speak a little bit more about that, about what your experience was with COVID exposure as you implemented those protocols.
I'm grateful to say that, overall, the exposure level has been very low. Though statistically here in New Jersey, the exposure rate for community-based or people who are being supported in home and in their community, the exposure rate was obviously much higher than group homes and some other living situations here in New Jersey. But FRN specifically, we were tracking day one. And then once we began to move back into providing services, we continued to track that. And exposure, yes, there's exposure, but not necessarily because of our staff. People have, took trips out of state and came back or was around somebody at one time. So, we tracked all of that. And I mean, we did have 2 deaths here at FRN as a result of COVID, but we didn't see an overall high exposure by continuing to provide the service at this time. We're still pushing back into it, but at this point, I'm happy to report that we haven't seen a spike or something in, starting to resume the service.
I think that's very reassuring for all of us to hear from you that have started respite services, that things are going relatively smoothly so far. I just want to let you know that Kim has posted her email address in the chat box too, in case you have any additional questions for her. And she also mentioned something that's very important when Jennifer was talking about recent changes in California and scaling back to phase 2, that we do talk about that in the guidelines, that it's really important to be flexible and prepared to pull back services. It's just as much needed. And again, as fortunately from what we've been hearing from everyone, things are going smoothly so far, but reassessing the situation at all times, I think, is really an important part of this whole process. Melissa had asked Jennifer if she'd be willing to share her trauma-informed care training materials. I would love to see that as well. I thought that was really exceptional that you mentioned that, and are you able to share that?
All right, I respond, yeah. So I would check in with, I don't see why not. I'll just check in with our leadership to make sure, but I'm sure it's gonna be fine. So I can send that over as soon as I get the okay. And I know Kim had mentioned the liability waiver. That one I have to check in with our legal team. It is very focused on the YMCA facilities, but there is a COVID part that maybe that might be more relevant that I can share with you guys as well.
Thank you. That's wonderful, Jennifer. I did want to mention there's the National Center on Trauma-Informed Care for Children that has produced some amazing materials specifically for children, including picture books for kids around COVID. And I'm about to post, some of their information is already posted on our website for parents and children, but I'm going to be posting more of those resources as well. So for those of you who are interested in trauma-informed care, they have some really incredibly exceptional resources, and check the ARCH website for those. I posted all of the links to the report and to the individual case studies if you want to read more about those. Kim reminds us that when Lisa was talking about what is your plan workshop and finding your new normal training, that's also referenced in the guidelines and on the ARCH website. Again, in line with Lisa's wonderful willingness to share all of their tremendous resources. And I think that was it. Everyone was very grateful. Thank you all. Again, it was really wonderful to be able to produce these guidelines, to have Kim with so much expertise involved with ARCH so that we could call on her to help develop those. The work group, thank you. Again, we're going to try to continue to feature case studies. So if you are a successful case study and you'd like to share your progress or your planning with the rest of the network, we would love to feature that. So please let me know. And stay tuned next week too for our respite LifeCourse tools and how to use those. Those are very much person and family-centered tools to help families plan for and use respite, and we're going to be talking about how they can be used during the pandemic. So join us next Thursday, July 23rd at 3 p.m. Eastern for that webinar. Before we close, I just want to turn it over to our speakers to see if you have any final thoughts or comments that you'd like to make.
Sure, this is Kim. I
Yeah.
just want to, again, remind people to, use these guidelines and to provide feedback on them. And if you have any additional information or questions that you come across, we want to continue to improve these so that they can evolve as this information and pandemic evolves as well. And finally, just want to thank Jill for her incredible leadership and seeing the need for this and being able to step forward to help create these great resources and references for all of you. And it's just really a privilege to be a part of this group. So thank you.
Wonderful. Thank you all so much.
I just want to echo that as well. Sorry. Thank you, Jill, for the opportunity, and Kim also for leading this. I was hesitant because we're so busy, but I'm glad I was able to join and talk to you guys and get more resources for ourselves and be able to share some of the work that we've all done through this time. So thank you so much for the opportunity. And I'm also available via email or phone if anybody has any questions. So thank you so much for the opportunity.
Again, thank you. We do appreciate how busy all of you are right now, and even more appreciative that you took the time today. So thank you all. Thank you all to those who are participating today. And we will be sending around a recording of the webinar as well as all the resources that we talked about today, so including the PowerPoint slides from today. Thank you all and have a wonderful afternoon. Thank you, speakers.